Well, ladies and gentlemen, I'm here with Dr. Sheila Mckenzie, and we have created a brand new program. The Humanitarian Disability Council program that we've created is just an amazing, groundbreaking program. And I'm so excited to be in partnership with Dr. Sheila Mckenzie. I'm going to have her give you a little background on who she is, and then we're going to explain our new groundbreaking program. Dr. Mckenzie, please tell our listeners who you are and what experience that you have in the type of work that we're doing.
Thank you, Dr. Rivers, for having me here today and for us to be meeting over this internet. My background is in health and in humanitarian, and in particular humanitarian medicine. I grew up on the small island of Jamaica. It is small, but it's very popular around the world. During my childhood, we had a strong spiritual. I was brought up in a strong spiritual families that emphasize worship, daily worship. We had to worship every day, and we wake up, and we also depended on the land. We depended on the medicines from the land, which is our ancestral types of medicines. My father was not educated in herbalism, but through word of mouth and through past word of mouth from ancestors that came down through slavery. Every person in Jamaica, in all of those villages, knew how to take care of themselves. Mm-hmm. I went to the local school and a religious school, and then I graduated and I received a scholarship to go to the dental school in the big city of Kingston, and become a dentist. While in that program, I had the opportunity to work on Her HHS, Her Majesty, the Queen of England, the other humanitarian ship that provides service in the Kingston Harbor. And I was privileged as a student to go and observe the doctors and the dentists and all of these things, all of these professionals, and also to assist them. And that indelible on my psyche. That was imprinted on my psyche to do humanitarian work. I was so impressed. And so I subsequently immigrated to Canada and worked for many years in many hospitals, in the dental department of a few hospitals before opening private practice. And then I became very sick. And of course, none of my colleagues, they are not grounded in preventative medicine or helping the body to recover. They were just grounded in giving you drugs, drug therapy, and that you cannot recover when you're suffering from exhaustion. It's called burnout. There's nothing in the medical profession that can help people with the burnout. They have to redress their health. They have to detoxify their bodies. They have to rebuild their cells, and there's nothing in medicine that do that. And so I reflected back on the therapies that we used when I was a child in Jamaica. And so I went and studied further into homeopathy. I studied homeopathic medicine. I studied acupuncture. I made myself available to all aspects of different type of healthcare, and I went to many different conferences. And so one day while I was attending a conference in Missouri, as God so had it, I met with a gentleman from the International Parliament for Safety and Peace. And I did not meet this individual until I went to the airport and I was back on my plane. And I met this guy and he was on his way to Europe. And I expressed to him that I wanted to do humanitarian work. And within a few weeks, I received a letter in the mail, because I did not know that this gentleman was was all the way up in the parliament. He was some kind of head person there. He was a senior member there, and he recommended me to the International Parliament for Safety and Peace. And my portfolio was mostly in the Middle East. I helped during the Iraqi war to relocate the children from Iraq to Syria during that period of time and to reestablish their lives, and that was part of my duty. So I worked with the International Parliament since 2003 to 2013, and then I went back to private practice, but I continued my humanitarian work. And I'm also a certified health educator under the UN Academic Impact. Because of that, members of myself and other members from the International Parliament for Safety and Peace, we decided based on the, this is a long story, but I'll make it short as I can, based on the UN declaration, Alma Ata Declaration, which was proclaimed in Alma Ata under the former Soviet Union in 1978. They were supposed to bring healthcare for all with special emphasis on developing nations. But at this great big conference with leaders from around the world, they had a good time, they packed their suitcases and then they went back home, and that was the end of bringing healthcare for all by the year 2000. And so members of the International Parliament and myself, in the spirit of the UN United Nations Declaration, we decided to establish the World Organization of Natural Medicine. This is a humanitarian organization to bring back healthcare through education to underserved people, because when we give handouts to underserved people, we disempower them. So during this great big COVID or world crisis, and I was told to close up my practice and stay at home, I decided what is going on? All these people were calling me from all over the globe to get answers to their problems. To their psyche was out, they were fearful, and all of these things were going on. And I said to myself, we need to do something about it. At this fork in the road, they're controlling people by fear. And I decided, and met up with Dr. Rivers, and we decided that we need to empower and educate the people to their ancestral medicine and to give them the power to take care of themselves. I was also, because of my humanitarian work, I'm also knighted. I'm also a Dame under the Knight Hospitallers, which is one of the ancient humanitarian organizations. I'm a Dame under that organization for my humanitarian work. And I'm also trained in international medicine, medicines of the developed world, kind of medicines that we don't practice in some parts of the developed countries. So I'm training all of these techniques, and I've been an educator for healthcare practitioners. I provide seminars and teach healthcare practitioners through the Canadian College of Humanitarian Medicine, which is a branch of the World Organization, how to expand their practice and offer humanitarian services to their clients. So it was out of all of this effort that we came together to start this program.
Wow, Dr. Mckenzie, that's your background is so amazing. And this is why people, as you watch this, you have to understand, Dr. Mckenzie is one of the top experts in the field, the World Organization of Natural Medicine. She's one of the elite in the class. As I started my journey with the golden rule, teaching people how to treat others the way they want to be treated, as I started my work of honor, and also understanding that we have about 8 billion people in the world. And as I traveled, I realized that people solve people problems. Everywhere I go and issues happen, I would talk to a person that would solve my problem. So I began to understand the value of people. Then in 2015, I was with the World Stability Day, and I was asked if I would become the world leading voice for World Stability Day. So I took that post because, prior to that post, I was doing the Golden Rule International with Ambassador Musi Hailu, a mentor of mine that was the head of the International Peace Building Initiative. I became his man for the North American division. This is a part of actually public information at the United Nations. So I started working with him, and I would travel around the world looking for individuals that were doing good and honoring them, because I discovered something. Many people are doing good, but no one knows who they are. So I started on my 30-year journey as a minister, moving to actually peace, moving to world peace through world stability. And now I'm the lead voice in world stability. We have impacted people and honored people in over 156 countries of the world for doing good for this world. So as I met Dr. Mckenzie and as we started dialoguing, we came up with the HCC, the Humanitarian Stability Counselor Program. And what it is we have to look out for the underserved people of the world, but we're also professional business people. So it used to be one or the other. You help the world or you do business. Well, this is a program that brings both, because businessmen and businesswomen love to help the world also. So our number one thing is to keep humanitarian services to help the underserved people so we can lift the world to become a better place for everyone. But also, we are skilled professionals in the work we do. So this is what makes our brand new program so exciting. It's for entrepreneurs, it's for businessmen, it's for health practitioners, it's for city officials, it's for everyone. It's a humanitarian stability counselor. And one of the things that I major in is communication health. You tell me an industry today in the world that doesn't need communication health. I can tell you, everywhere you go, there's strife, there's confusion, and there's instability. But all these things are solved through healthy communication with clarity. And this is why our HCC classification that we have created, it's, Dr. Mckenzie, this is literally earth-shaking, because it's the first program I've seen that still cares about humanity, but allows people to do business as well. And that's what makes our program so effective. You understand about health, but you'll understand about healthy communication, which the whole world needs as well. What are your thoughts, Dr. Mckenzie?
So when we combine communications and we provide health, it's a perfect match for helping the world. Because when we are unhealthy, we cannot think clearly, because what we eat, what we consume, when we're toxic, it also affects our brain and the way of thinking and our emotions, and we become uncivilized. What's the word civility means? To become civilized. Civility comes civilized. We become incivility, and so we have this problem. So the mind, body, and spirit and communication, all of these things go together. And so we have to go to our ancestral way of doing things. And so when we do these things and the next crisis comes along, we will have power in our hands, and the people will not be scrambling and don't know what to do, because you are going to be the expert in their community. You're going to be the go-to person. If you have a group of people that you're leading now, you are going to be an outstanding leader. And you're going to just be enhancing your business and making such an impact on the community. There's not going to be anyone out there like you. You're going to be so unique by participating in this program. It's just a one-of-a-kind program.
Yeah, Dr. McKenzie, it brings joy to my heart because I understand when you travel the world and you look at different countries and we look at the real power the institution has. I mean, humanitarian health and civility, it's a new narrative that the world cannot do without. Like, as we first met, I didn't understand how, I mean, civility was a part of natural medicine and natural health. And then when you told me the power of actually stress, when someone is actually stressed out, the effects it has on the body. And when you explained that to me, it opened my eyes. I go, now I see where if someone understands civility, self-civility, how to take care of themselves in a civil standpoint in communication, they will keep stress away, which allows them to have a healthier body. This is what inspired me. I said, this is it. So I didn't know, I knew there was integrative medicine, but I didn't understand how civility played a role, but I do now. And this is why I can tell every one of our students, when you finish this course, you can start your own professional counseling, consultant business, or as a coach, and you are a top level practitioner because of the HCC classification behind your name. Dr. McKenzie, I thank you for actually fighting to actually allow us to have our own designation in natural medicine. Thank you for actually fighting and allowing our program to have that endorsement and that certification.
Thank you, Dr. Rivers, for having me to explain this. And we look forward to changing the world because we can start with our families. It doesn't mean that you have to go to foreign lands to start this program. When you start this program on day one, you can start helping your families, your neighbors, your communities. On day one, we'll give you the resources to get started on day one. And so when you become certified, you can start with your community, or if you have a business already, you can expand on your business. So it's a beautiful tool for us to change the world and to help humanity. Thank you for having me, Dr. Rivers.
Thank you so much. And people, we want you to sign up for this program today. It's groundbreaking, world-changing. Just imagine this. If you went to every company that actually needed that communication health, ask their actual HR department, hey, are you struggling with how to communicate? Wow, well, I'm the one that can train you in healthy communication. See, that's a business model. There's all these business models that we have as we open our minds to the opportunities that will come through this HCC program. Please, people, join today. Dr. McKenzie, they can find us at the Canadian College of Natural Medicine.
No, Canadian College of Humanitarian Medicine. Canadian College, Canadian College, ACCHM, Canadian College of Humanitarian Medicine, -edu.org. Or you can send Dr. Rivers or myself your emails to get connected to the link. And the registration form is there on the link, and we're all ready to go and to sign up. The beauty of this program is that you can start immediately because we are pre-recording the units. And once you register, you will get a password to be on the college classroom to listen to the various presentation from Dr. Rivers and myself. And we will be meeting with you twice per month. You're not going to be on your own. We're going to be guiding you. You're not going to be just going in a classroom, listening to some tapes, and then that's the end of the story. We're going to be working with you on a personal level so that you're successful, and you're going to be on the first set of students to be graduated in October. So we are going to be with you every step of the way. So Dr. Rivers, just tell them a little bit more about what they're going to be getting. They're going to be getting the CCHM diploma in humanitarian health and civility. They are going to be getting the endorsement from the World Organization as a humanitarian civility counselor. They're going to be we're going to provide a social media site for them. We're going to establish that. And we're going to also, once they graduate, we're going to have their ability for them to join into our network. We're going to have referral services. So it's just awesome. It doesn't stop there. You're partnering with us for life to make a change to the world.
And people, I've been doing this work for 30 years. I've never, ever seen an opportunity like this. And I'm telling you, this designation of natural medicine, the HCC, it will go all over the world. Colleges, I mean, universities are going to pick this up because this is a model that works. So I'm excited to have you be a part of our inaugural class. Please, the first of its kind in the world. And that designation of a humanitarian stability counselor will be a new label, a new designation for you in the world of natural medicine. Dr. Mckenzie, thank you so much.
Thank you so much, Dr. Rivers. Thank you.
Bye-bye.
Bye-bye.